Hello guys, this is me Dr. JK, and today we will discuss about cyst, its classification and epithelial remnants. It's a bit brief, a description of cysts. So after that we will start this topic of cysts one by one. So today we will discuss about the definition of the cyst and what is true cyst, what is pseudo cyst, what is the classification of cysts and the epithelial remnants. So first of all, the definition of cyst. Cyst is a pathological cavity having fluid, semi-fluid or gaseous contents and which is not created by the accumulation of pus. Most cysts, but not all, are lined by epithelium. So you should keep this point in your mind that there will be no pus in the cysts, okay? And plus, if we talk about the epithelial covering or lining, if the cyst contains the epithelial covering or lining, it will be known as the true cyst. And if there is no epithelial lining or covering, then it will be known as a pseudocyst. They both are cyst, but one is true cyst and other one is pseudocyst. The example of true cysts are dentigerous cyst, the keratocyst, periodontal cyst, and all those stuff we will discuss about later on. And pseudocyst, they contains aneurysmal bone cyst, traumatic bone cyst, simple bone cyst, etc. So now we'll discuss about the classification of the cyst. So it is classified into the cyst of the jaws, cyst of the maxillary antrum, and cyst of the soft tissues of face, oral cavity, and neck. So first of all, we will discuss about the cyst present in the soft tissue of the oral cavity, face, and neck. It may contain dermoid cyst, epidermoid cyst, benign lymphatic cyst, salivary gland cysts, thyroglossal duct cysts, parasitic cysts or hydatid cysts, cysts of the oral region of gastric epithelium, anterior lingual cyst. Then we have the cyst of the maxillary antrum, which may contain benign mucosal cyst like mucocele and mucosal retention cyst, and second is the post-op maxillary cysts. Then we have the cysts of the jaws, which may be epithelial and non-epithelial. The non-epithelial is also known as the pseudocyst, and it will be traumatic bone cyst and aneurysmal bone cyst. And the epithelial, which is a true cyst, is further divided into developmental and inflammatory. Inflammatory will contain the reticular residual cyst, and developmental will be further divided into odontogenic and non-odontogenic. Odontogenic are those which are derived from the odontogenic origin, and non-odontogenic, of course, they are not derived from the odontogenic origin. So non-odontogenic will contain nasopalatine cyst, nasolabial cyst, median alveolar cyst, median palatal cyst, median mandibular cyst, and globulomaxillary cyst. Whereas that of odontogenic cyst will contain primordial cyst, also known as keratocyst. But now in recent classification, they both are different. The primordial is different and keratocyst is different. This is old classification, so that is why the primordial cyst is written alongside the keratocyst. Okay, so dentigerous cyst, eruption cyst, lateral periodontal cyst. The periapical, periapical will be inflammatory, whereas the lateral periodontal cyst is there in the developmental. Okay, and in the developmental it is present in the odontogenic list. The gingival cyst that may be present in the child or adults, and calcifying odontogenic cyst, also known as the Gorlin cyst, basal cell nevus syndrome, and botroid odontogenic cyst. So this was the classification given by the Shear, and it is the broad classification where all the cysts can be there. Okay, and it is very important if we want to start the topic of cysts. So you should memorize this classification. It's easy, just you have to revise it 2 to 3 times. It will be easier to learn. Okay, then we will discuss about epithelial remnants, the remnants from which the cysts are derived. So it may be rests of malaces, that is from the Hartwig's root sheet, and it may contain radicular cyst, residual and lateral cyst, and it may be reduced enamel epithelium, that is derived from the inner enamel epithelium, and it may contain paradental cyst, calcifying odontogenic cyst, dentigerous cyst, and eruption cyst. Or it may be rests of series, that is also known as the or we should say that is derived from the dental lamina, and it may contain odontogenic keratocyst, lateral periodontal cyst, gingival cyst, and glandular odontogenic cyst. So this was all about the definition of the cyst, what is true cyst, what is pseudocyst. Then we have discussed about classification of the cysts of the orofacial region and neck, and after that we have discussed about the epithelial remnants. So this was the lecture, and if you like my lecture, please subscribe to my channel, and we will make more and more videos on oral pathology. And till my next lecture, take care and bye bye.